Let's now shift our attention to the other big story that we are tracking on WION. And this is about what has been happening in South Africa in relation with the COVID-19 infections, where after a massive surge that was witnessed from the month of November, mainly driven by the very fast-spreading Omicron variant of the coronavirus, cases in South Africa and indeed in large parts of Africa have started to plummet. According to the United Nations, the COVID cases have dropped in Africa, and so have COVID-related deaths that have also declined for the first time since the fourth wave of the coronavirus reached its peak. The newly reported cases have fallen by almost 20%, while the number of confirmed deaths linked to COVID-19 have also dropped by almost about 8%. The WHO, meanwhile, has termed the region's 56-day virus flare-up as Africa's shortest upsurge so far. South Africa, where the mutant variant was first detected, has now recorded a downward trend for the past 4 weeks. The cases have also declined in other parts of the continent as well, with only North Africa reporting a slight increase with a 55% spike in the number of infections. And it's not just in Africa that there's been a drop in the number of infections. The United States also seems to be emerging from the latest wave of the pandemic. The declines have been most pronounced in states that were first hit by the fourth wave, particularly in the Northeast, including in places such as New York, New Jersey and Maryland. All right, now to give us more insights in terms of what is happening with the Omicron mutant variant of the coronavirus, we're joined in with Dr. Angelique Coetzee, who's joining us live from Pretoria in South Africa. Now, Dr. Coetzee was in fact the first doctor to have flagged off the Omicron mutant variant of the coronavirus in South Africa. Dr. Coetzee, thank you very much indeed for joining us on this broadcast. So let me begin by asking you this. This is the data that has now come forth, that the number of infections that are now being reported linked to the Omicron variant and indeed to the larger coronavirus infections is now beginning to drop in South Africa and indeed in large parts of Africa. Are we looking at a case where we've seen the worst of the Omicron variant of the coronavirus?
Good afternoon from South Africa. Yes, if we look at the 7-day average, moving average of South Africa, it's almost 5 cases per 100,000 population per day. And if we look at that, it indicates that it might be the end of this wave. And it's important for us to actually end this wave, because what we have seen, and this is the bad news, and that's why we still can't start to rejoice, that seems that we have a 3-month fallout sort of period for low transmission, and then another wave starts again. If you look at the trend in South Africa, it seems that there's 3 months between these waves. And it is important then in this next 3 months to prepare our citizens again, make sure everyone is vaccinated, make sure sanitation and all of that we keep on talking about is out there. And the other thing for us here, what we are seeing is, again, our cases are very low. Even our ICU cases, although we never had a lot of ICU cases, but even our ICU coming down, and that is also important. And our death rate definitely low, not the same than it was with any of the previous 3 waves.
Absolutely, indeed. So is it now, Dr. Coetzee, now safe to say that the Omicron variant was in fact a much milder variant, although it spread much more rapidly and infected a lot more number of people, but the rate of hospitalization and also the deaths linked to COVID-19, especially due to the Omicron variant, have been much less in comparison with the other mutant strains, such as the Delta strain?
Yes, from a clinical perspective, definitely. It is definitely a mild disease. I think we need to clarify the term mild, because that is according to the WHO definition of mild COVID-19, and we are in full agreement with that. However, people think if we use the term mild that they're not going to get sick. That's not what we're saying. Mm-hmm. But there will be people, again, unvaccinated, what we have seen in our ICUs, that will be the majority of people lying there. But the if you look at it in a broad spectrum and the community-based level, yes, it is mild, and hospitals actually should not be overrun by Omicron itself, if we look at the clinical picture.
Absolutely, indeed. And you pointed out at a very important sort of a cycle in terms of how we've witnessed these waves. A wave comes about, and then for about 3 months, there is a period of, to use the word, there is a slight lull in the number of infections that are reported, and then there could be another variant that could come about. Especially given the fact that Africa at this point of time has had just 14% of its population that's been double vaccinated. Is this a serious concern that not all parts of the globe are getting access to vaccines as one would hope they would get?
Yes, it is a serious concern. I fully agree with that statement, that not everyone's got access. But remember, even if you literally dump the vaccines in certain countries, you still need to address the HR and the cold chain storage problem. So it's actually these two problems is hand in hand: access as well as distribution. The cold chain or the supply chain. If that's not in place, you can give us as much as you want. It's not going to help us, and I think that's what makes it so difficult in Africa. And this virus, the Omicron, I call it a hit and run viral infection, because it escalates or it peaks and infects people at an alarming speed, and just as fast as it came, it starts to decline. And it would be interesting to see what is going to happen within the next 3 to 4 months. And I think that that one needs to wait for at least 6 months minimum before we can say, yes, it is going to become endemic, or what is going to happen. We would like to see it more endemic than pandemic, but it's still also early days.
Absolutely, indeed. Thank you very much indeed, Dr. Angelique Coetzee, for joining us from South Africa and getting us all those insights. Next few weeks and indeed next 6 months will be very crucial to see as to what becomes of the COVID-19 infection. But it is quite likely that we could see more mutant strains of the virus flaring up. WION is now available in your country. Download the app now and get all the news on the move.